Hi, I'm nursing student Jason. Let me be surprised here. Somebody must have forgot to throw that away. So I'm going to go ahead and the paperwork here says I'm going to be giving you 800 micrograms IM by in your deltoid, and but first I have to make sure that you are who I think you are. Can I get your name and date of birth, please? All right, well done. Good job, you remember. All right, well, I'm gonna go ahead and get your medication ready, and then I'll be back, and we'll give you that shot. I'm just gonna 3 fingers below the shoulder there, and you're probably gonna, you might feel a little irritation there, a little soreness, but yeah, it's probably nothing that you haven't felt before. All right, well, I'll leave that ready. All right. So, gonna go ahead and I have to get, let's see, however you pronounce that, 800 micrograms IM. First thing I'm gonna do is go ahead and wash my hands and get this ready. So, wash my hands, 20 seconds, and dry them. Turn it off after I dry it, or after I dry my hands, turn it off with the thing, and paper towel. And now I'm going to go ahead and collect up my, you know what I want to do? I'm going to, just for the heckers, I'm going to go ahead and clean my ampule. Place that back down here, and I think I'm gonna go ahead and I'm gonna glove up as well, and I'll make sure I've got all my patient rights. So I know I've got the right patient. Let's see, it's the right time. I've got the right medication. I've got the right indication. They need their vitamin B12. Let's see. When is the? Just want to make sure. Yeah, that one is the B12. All right, it's make sure. So I want to make sure that. So I've got the patient, time, indication, dosage, which is I need 800 micrograms, so that's 0.8 milligrams that I'm going to get out of the ampule, and then dosage, and then I'll perform my documentation, and I know the right route because I'm going to put it in their deltoid. So, and that's all my patient rights. Okay, so now, and I've been touching my shoulders with my gloved hands, but I would go ahead and sanitize my hands again and put on some new gloves. Okay, so now what I'm going to do is I'm going to take this and I'm going to put that on there, and I'm going to prepare my needle as well. I'm going to be using a filter needle. Okay, throw that in the garbage. And then I'm going to go ahead and I'm going to get 0.8. Well, actually, I don't even, so I don't have to give it air this time. But so I've got my needle ready. I'm going to go ahead and break this away from myself. I can shake it to make sure there's not in there in the top, but I know there wasn't any. And I'll break it away from myself, like so. And then I can go ahead, I'll put that right there. And I'll take my filter needle and let me put that right here. And go ahead and invert this 0.8. There's 0.8. Let's see a little bubble. Now I'm going to go ahead and get that bubble out of there. And I'm going to go ahead and get more. All right. So now what I'm going to do is I'm going to put this back on my filter needle, and I'm going to switch needles. I'll prepare this one first. All right, and I'll go ahead. I'll take this off. I'll put this in the sharps container. Take this needle. Go ahead. Put it on there like so. Okay. Take this. And now I'm going to label this with the patient's name and what the medication is. I'm just going like that. Okay, after having written on it, now I'm going to put this in my little receptacle so that I can take it to the patient's room without just walking around with a needle in my hand. So, all right, so now I'm going to take my gloves off and I'll go to the patient's room with my documentation. I'm going to verify the documentation again once I get here. All right, I know I've got all the patient rights, and so I'll let the patient know I'm going to be doing this in your deltoid. And so the first thing I have to do, I'm going to do some hand hygiene, and then I'll be right back with your medication. Hand hygiene. All right, put on some gloves. I'm burning through these gloves. Sorry, now I'll get you more gloves. And all right, and now I'm going to come over here and put this on the bedside table while I get the patient in position. All right, so I'm just going to help you turn here. Are you feeling nimble? All right, we're going to turn. What I'm going to do is, so I'm going to go three finger widths below, so about right here. I'm just going to, that's the spot that I'm going to be cleaning with alcohol swab in a circular motion. It'd be a lot easier if the patient stays still. So I'm going to go ahead and so I'm going to go right there, circular motion. I'm going to be doing this, pretend this is their deltoid. So now when I do this, I'm going to use the Z-Track method. So I'm going to try to move their skin a little bit so that when I inject the medication, then I'll be able to pull it out, and the subcutaneous fat will seal the medication into the muscle. So, all right. So now I'm going to ahead and so I know I know visually where it is. So I go like this, and I'm going to stick it and go, and then I will. Now on the gluteal, I had to do it for 10 seconds, but here I don't believe that I have to. I'm just going to pull this back out, let that go. I'm going to put the safety thing, click that into place, and then I'm going to go ahead and use the cotton swab that I normally keep there. Put that right on there and hold it, and make sure it's not bleeding. And all right, I'm going to go ahead and clean up and see if the patient has any questions of me. Make sure they have their call light, and go ahead and I will document everything that I just did, and I'll make sure that I put my my needles into the sharps container. I'm actually for class purposes, someone's going to reuse this needle, so I'm not actually going to throw it away. But so anyway, yeah, and I think that's everything. I will see you later. Have a good day. All right.